June is Men's Health Month, and health experts say too many men wait until something feels seriously wrong before they see a doctor. So here with more is DAP Health Director of Adult Medicine, Dr. Rzai. Welcome, doctor.
Hi, nice to be here.
So first and foremost, why are men hesitant to get to the doctor?
So there's multiple factors that influence this. So biochemically, men do have hormones, right? So like testosterone is going to have us want to be resilient to coming in, trying to tough it out. There are culture stuff that also influence how our upbringing has been regarding, trying to be the macho man. So there's multiple influences that, let's say, like stigmatize or cause us to not want to go in and to be as strong as we can before we ask for help.
Yes, it's hard to feel weak, I guess, or to admit weakness. But why is it so important?
So it's very important to be able to have these conversations so that you can address whatever concerns, thoughts that you have about whatever's going on in your body that you don't get to share with other people.
Mm-hmm. So we're talking about a primary care clinician?
Yeah.
So you start there?
Yeah. So I would say like primary care is almost like the parents. It's a good place so that patients could come to DAP and be seen, heard, and affirmed, and be able to ask any questions. So that's the beginning block where we start to do all our screenings. So women have different screenings like mammo and pap smear. Men will have particular screenings like a AAA screening if they ever smoke. Both would do colonoscopies, but the funny thing is at certain ages you get screened. So like women at 65 will get a DEXA for the bone. Men won't, but we'll get that AAA screening if we ever smoke. So there's a lot of screenings like PSA, and if you don't get to come in, you don't know.
Right, exactly.
Yeah.
How about sexual health?
Yeah, that's very important. So if you're, it's very common for people to have sex. So, and there are also risk factors with that.
Right.
So if we're not using the proper protection, you can get an infection and not know it. Mm-hmm. So there are some infections that you can get that if it's not screened, it can develop into very complicated situations. So it's good to be able to have those conversations. And also there's new medicine now that if you choose not to use protection, stuff like PrEP, you can get it done and it's going to protect you from the exposure because it's in your body, like a vaccine.
Gotcha. And the screenings that are done are HIV?
Mm-hmm. So HIV, chlamydia, gonorrhea, syphilis, hepatitis. We check that every time.
And the other type of health that men seem to shy away from, mental health.
Yeah. So, they say like if you don't ask, you can't really talk. So, I believe there's no stupid questions. So we really do our diligence at screening. So we have like depression screening, anxiety. But again, mental health, I tell people it's like a car. Your body is the vehicle and the driver is the mind. If we can't share what's going on in our mind, we don't know where to go to. So we have screeners, but providers are also trained to sort of read our body language. Mm-hmm. So we encourage our patients to share what they're thinking so they don't turn to like alcohol or drugs to numb that.
Right.
There's other ways, and talking expresses your concerns and doesn't build up in the body. Mm-hmm. So you're able to get it out, and we can guide you with medicine or therapy, different varieties based on what you want.
Hopefully we're getting past the stigma and shame of admitting that something could be wrong mentally, right?
Correct.
There's no reason to feel embarrassed about that.
There should not be at all.
So what's the most important message, if men are listening right now, that you want to get out there?
So we want all men to be seen, heard, and affirmed. If you have any questions, come to your primary care doctor and let us help you find the solution for whatever you have questions about.
Dr. Rzai, you're very smart. Thank you so much for shedding some light. This is really important stuff.
I agree, and we're here to help any way we can.
Thank you so much.
Thank you.
Men often delay getting care, but preventive checkups, screenings, mental health support, and STI and HIV testing can improve and even save lives. Taking care of your health isn't a sign of weakness. It's one of the strongest things a person can do. To learn more about becoming a patient at DAP Health, visit daphealth.org.